Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In this video, we will discuss today codes related to circumcision, one of the most important topic in the male genital system. We will go over key CPT codes related to circumcision, the relevant guidelines and practice questions to help you to better understand the concept. So without further ado, let's get started. In the male genital system, circumcision code 44150 is used when the provider performs circumcision using a clamp or similar device along with dorsopenile or ring block. It is important to note that the code 54150 should only be reported when both clamp along with dorsopenile or ring block is used. If the circumcision is performed with a clamp but without dorsopenile or ring block, use the parenthetical instruction given below the code 44150, which states without dorsopenile or ring block, report 54150 with modifier 52. Code 54160 and 54161 are age-based CPT codes used for circumcision procedure performed using surgical excision or techniques other than a clamp device or dorsal slit. CPT code 54162 is used for the lysis or excision of penile adhesion that develop after circumcision. In this procedure, the provider breaks down or surgically removes the adhesions that are formed on the penile tissues following the initial circumcision. CPT code 54163 is used for repair of incomplete circumcision. The patient is not having the circumcision for the first time but needed a repair from the previous circumcision. The provider removes excessive residual foreskin left over from the previous circumcision. CPT code 54164 is used for frenectomy of the penis, in which the provider incises the frenulum of the penis. The provider performs this primarily to release the tissue, restricting the movement of the glans penis. When reporting circumcision procedures, there are some key points. Never append modify 63 with circumcision code 54150, 54160, or 54161 as it is not appropriate in these cases. For circumcision performed with clamp and regional dorsopenile or ring block, use CPT code 54150. If the same procedure is performed with a clamp but without regional dorsopenile or ring block, report 54150 with modifier 52. In contrast, for circumcision performed without clamp using surgical excision, select either code 54160 or 54161 depending on the age of the patient. When reporting circumcision procedure, it is important to select the correct code based on whether the procedure is an initial circumcision or post circumcision intervention. Always remember CPT code 54150, 54160, and 54161 are used for initial circumcision procedures. For procedure following a prior circumcision, such as repair or excision of adhesions, use CPT code 54162 or 54163, which are specifically designed for post circumcision interventions. A 6-month-old infant who had complications during the birth process, which prohibited him from having a circumcision shortly after delivery, arrives at operating room today for a circumcision. The foreskin was clamped and removed. The infant tolerated the procedure well. Which of the codes best describe this encounter? Option A with code 54150, option B with code 54150 along with modifier 52, option C with code 54160, option D with code 54161. In the given scenario, circumcision was performed on a 6-month-old infant using a clamp to separate the foreskin. Based on this information, we can easily eliminate option C and D with code 54160 and 54161 as these codes are used for circumcision performed using surgical excision or techniques other than clamp or device. Among the remaining two options, A and B, both with code fit 4150, which is used for circumcision performed using a clamp. However, in this scenario, the circumcision was performed without dorsal or ring block. We choose the correct option based on the parenthetical instruction given below the code 54150, which states report 54150 with modified 52 when the procedure is performed without dorsal or ring block. Based on this guideline, the correct option is option B with code 54150 along with modifier 52. A 3-year-old child is being seen today for circumcision. Child has recurrent yeast infections, candidal balanitis, and phimosis. The patient is presented in the usual manner. General anesthesia is administered. With the patient in the supine position, the foreskin is retracted. The preputial adhesion were broken down. Circumcision was performed by surgical excision using the sleeve resection method. The patient tolerated the procedure well. What procedure and diagnosis codes are reported? Option A with code 54161 and 47.1 B37.42. Option B with code 54150 and 47.1 and 48.1 B37.9. Option C with code 54160 and 47.1 and 48.1 B37.8. Option D with code 54161 and 47.1 B37.9. In the given scenario, a 3-year-old child is being seen for circumcision. The procedure is performed using surgical excision with sleeve resection method. We first eliminate option B with code 54150, which is used for circumcision performed with the clamp. Among the remaining options, both code 54160 and 54161 are used for circumcision performed using the surgical excision method. As both codes are age based, next we eliminate the option based on the age of the patient. Since the circumcision was performed on 3-year-old child, we can easily eliminate option C with code 54160, which is appropriate for neonates age 28 days or younger. In remaining option A and D, we select the correct option based on the diagnosis code. In this scenario, the child presents with recurrent yeast infection, candidal balanitis, and phimosis. We eliminate option D with code B37.9, which is used for unspecified candidiasis. However, the correct diagnosis in this case is candidal balanitis, for which the appropriate code is B37.42. Therefore, the correct option is option A with code 54161 and 47.1, which is used for phimosis, and B37.42, which is used for candidal balanitis. A 16-day-old baby is in operating room for a repeat circumcision due to redundant foreskin that caused circumferential scarring from the original circumcision. Anesthetic was injected and an incision was made at the base of the foreskin. Foreskin was pulled back and the excess foreskin was taken off, and the two raw skin surfaces were sutured together to create a circumferential anastomosis. Select the appropriate code for this surgery. Option A with code 54150. Option B with code 54160. Option C with code 54163. Option D with code 54164. In the given scenario, a repeat circumcision is performed as the patient is not undergoing circumcision for the first time but requires a repair from the previous circumcision. Based on this, we can easily eliminate option A and B. A's code given in both options are used for initial circumcision procedure not for revision or repairs. As in the scenario, the physician does not incise the membrane of frenulum, did attach the foreskin of the glans and shaft of the penis. We can easily eliminate option D with code 54164, which is used for flenotomy, a procedure to release tissue restricting the movement of the glass penis. Therefore, the correct option is option C with code 54163, which is used for the repeat of an incomplete circumcision. Thank you for watching. If you have any question or need further clarification, please feel free to write in the comment section. For more detailed guidelines, CPC mock exam related questions and notes, email me at the giving email ID.